Compared to when I first walked in, I feel less tense in my upper back and a little sore in the bottom here, but there is definitely more movement.
Okay. Headache?
Slight headache.
So that reduced after the adjustment?
Yes.
Okay, good.
My sister was driving. I was the front passenger. And the position I was in was this because I had just bought food. I had a burrito and sauce in my other hand. So I was like this. And I remember she came and hit the front part. And it hit it kind of hard because I went like this and like that. So much so that the sauce splattered on the window.
Oh. Okay,
yeah, so I know that I went like this. It was a movement, you know. So within 10 minutes, I felt my shoulder was achy, and then a headache, and then, you know, as the day progressed, it was upper back to mid back, neck. You know, the headache was more intense.
Headache. On a scale of 1 to 10, how bad was the headache?
It was about a 9.
Okay.
It was pretty bad. Yeah.
All right. Within 10 minutes. Wow. Okay. Shoulder, right shoulder?
Right shoulder.
Pain.
Yes, 9.
Bruised too?
No.
Okay. And between your shoulder blades?
Yes.
Is there?
Also 9.
Below the shoulder blades, but above the low back.
So like here.
Yeah.
Like a like when I press on it, it's like maybe like a 4.
Okay. It's stiff.
That hurts.
Not happy that way.
No.
Okay, forward bending. How about there?
That's okay.
Side bending to the right. Right lateral flexion. Here's your easy side.
Yeah.
Okay, this is right there.
Yeah.
Okay. Atlas here will compare atlas vertebra, number 1 and number 2 here. This should separate here. Okay, here. Tender here too.
Oh yeah. Ow.
Condyle against atlas. That's pretty good. Other side now. See, turn it this way. A little bit easier.
Yeah.
A little bit easier. That's one normal. Not totally normal. Certainly not your normal.
No.
Okay. Tender here too?
A little bit, yeah.
This was
more on this side, yeah.
Ah, sharp. Move it all the way off. We'll have to set it down to the lower scale to even get a reading on her neck. It's pretty inflamed. Right there. Right there. And we'll mark it with a skin marker. Up a scale from that. Just restore it. It's right there. What I do here is I mark it, and then I recheck my line to be sure I marked it correctly, right on the exact, at that peak, where that needle peaks out on that right side. Get down in the shadows there, huh? Right. It's a small break right there. Pressure there, the skin will actually shift to the center. As you bring your fingers down like this, it'll be right there. And that's actually where We marked it with the scope too, right there. That's pretty clean now. There's number 5, 4, 3, 2, 1. There's 12, 11, 10. Right here at 10. Tender here?
Yes.
Here too?
Yes.
Okay. More at 11
Yes.
or more at 10?
11.
Okay, right there. Now let's check side bending this way. And side bending this way. That locks up right there. That's right there. That's at number 11. Lower spine here for swelling again. Number 5 is just at the crest here. That's 5. Tender here,
Yes.
right there
Yeah.
for swelling. But we come back this way,
Yeah.
right there.
Yes.
Okay. Okay, stand here, touch here. Put the leg raise check here. Here we look for the range of motion. This should just drop nice and easily. Raise your right knee towards the ceiling 3 times, nice and slow and easy. That's pretty stiff. Hurt to do too.
A little bit. Yes.
Other side. This is more normal, much more normal. There. There. This side, when you raise this, right side, it does not move down. It actually climbs up instead of coming down. Normal movement is this. This left side is normal, the right side is definitely restricted. How about reaching down, touching toes? Is that what you do? You cannot.
Far as I can go.
About 6 inches there from the floor, which is a long way when you're only 5 foot even. So, okay, an extension for turning. Just keep your feet flat. How about that way?
Yeah, it's a little tight.
On the right side?
Yeah.
Left side, yeah. This way too?
A little bit. More on the other side.
More on the right, yeah. And down to the tailbone. And this right side joint is very restricted in terms of its range of movement. Extension hurts to do here in the center. And here's our x-rays we took this morning. Neck curve from the side is it's actually reversed. It's kind of called a kyphotic neck. And she has a neck curve that's actually slightly reversed right through here. It starts here where it starts reversing, goes from 3, 4, 5, and 6. And so 6 and 5 are both pretty sore to the touch and do not move properly. The range of motion is restricted on both flexion, extension, and side bending to the right. Number 1 is very sore on the right side, which is right up in here. And its range of motion is very tight and very restricted on that right side from when you rotate from center to left. Mid-back, pretty good curve through here, flat through here. Right here is really pretty flat. So from 5, 4, 3, 2, 1, 12, 11, and 10. It's kind of lost that curve through there. Down low, sacral base is actually back, which makes this look like a level disc, but it is actually slightly back of number 6. And she has a thin disc at number 5, 6. So that needs to be addressed. From the front view, pelvis on the right side is not moving properly. With the leg raise check, it does not move. It's swollen, it's tender, and its range of motion is very restricted. The left side actually has very good movement. That one has turned out like this and slightly down. So it's turned externally rotated from the center of the spine, and it's actually posterior inferior. When it goes posterior inferior, it widens this out too. Slight bending to the left, and then a fairly compressed curve that really starts to bend off to that right side. Here's 12, 11, 10. That's, in terms of how it looks on the film, it's actually fairly straight, looks pretty decent. How it functions on her is not. It's swollen, it's tender, it's painful, which means that the spine is just, the body's guarding that. Also very, very sore to the touch up here at 1, 2, 3, 4, 5, 6, and 7. And at numbers 5, 6, 7 here, and up here at number 1. Base of the skull and number 1 on that right side. Okay, we'll be adjusting the right ilium, PIEX. PI means posterior inferior, and EX externally rotated. Externally is this way, PI is this way. These go the opposite way. That's good. These hands keep each other company, so they don't get them. Down good. Straight up here. This right here is all the twist you get. That's it. So, that is, some of it.
Yeah.
More. That way.
Yeah. Okay.
Just close it. Yeah. Walk a little bit when you're ready. Walk that off a little bit. See how that feels.
Yeah, I did feel a little tilted.
When there's some correction on the ilium, the hip bone, it changes the femur head height one to the other.
Okay.
So it'll make you feel tilted for about 10 to 15 seconds.
Okay.
Raise your right knee towards the ceiling. A little easier.
Yeah.
Gotcha.
Yeah.
One more. Yeah, that's good. That's much better. And again. And once more. See that? Before it was actually climbing up and in, and it wasn't moving very well. And this joint, that actually moves considerably better. Right side again, right there. So that's doing better. Yeah, I think the best one to do is this right up here. Right there, see?
Yeah.
Okay. Okay. We'll be adjusting first cervical vertebra, number 1. And it has gone AS, anterior, superior, and off to the right side. That way.
Oh yeah. Not that one.
Hurt both joints too?
Yes.
Which is here. Now you should turn. Oh my goodness, that's good.
Yeah. Wow. I already moves now.
Okay, now you just had this adjustment. We adjusted the right ilium and first cervical. How are you feeling now?
Compared to when I first walked in, I feel less tense in my upper back and a little sore in the bottom here, but there is definitely more movement.
Okay. Headache?
Slight headache.
So is that reduced after the adjustment?
Yes.
Okay, good. That's a very good start. Okay, after your last adjustment, how did you feel?
Well, since the first adjustment, my right shoulder, I can move it now. There's more, range of motion. My neck is much better. The low back and the upper to mid back area is still kind of the one that's giving me problems. It's hard to sleep at night because it's just so tight.
This area, yeah.
Yeah, and the headaches are less frequent.
Okay.
So that's much better.
We'll put that on the soap notes and
Yes.
we'll go with that.
Okay.
That's good. There's not much rotation here. And there's slight rotation to the right, but it's very slight. 11. There's the one that's swollen. And so I'm choosing to go ahead and adjust it as a PLS instead of a PLIT. Okay, just that right there. More skin slack there. That's a good one. Takes your breath for a few seconds.
Yeah.
Diaphragm's right there. So it's going to do that. Big release.
Yes, much better. Thank you.
Breathing is a nice option.
Yeah. A little dizzy, but yes. Breathe there.
Yeah. The swing's actually to the other side now. See that? Yeah, when it switches sides like that, that's good. It'll look like a break, but it's on the other side, so it's good.